I think the pressing concern would be Corozal, where we have had to do what's called the shifting of health services. You know, in Corozal has, for example, an NHI and a non-NHI element within the hospital. That has been taken away for the time being because of your resources and because of the infrastructure. So that in point of fact, you would have just an inpatient department. There is no patient that in the outpatient that is classified as NHI nor non-NHI. Then you have a ward for persons under investigation, a ward for COVID-19 patients, and maternity ward. So you are basically working with the numbers as you go along. So Corozal, for example, this morning reported that they had 12 patients hospitalized. 6 patients are under investigation, which means they are pending a confirmation of a result, but you treat it as a potential positive case. And you have 6 patients hospitalized are confirmed positive, which means that for that area, they would have 5 beds available. But through the weekend, they went up to 17, which is the max they have had. So you shift your health services based on where you are going. You cancel elective surgeries. You may have to cut back on your outpatient department. Patients that can be discharged and be followed up at home, that can be done as well, or that is being done wherever, depending on the numbers that you are seeing. So I think to answer the straight answer would be Corozal and Orangewac, and also San Ignacio, Belmopan, we are monitoring closely because of the amount of patients turning up in that area. South doesn't seem to be having that situation as yet. You have to factor in the fact that beyond the physical infrastructure, we're also having health staff that is turning out positive, particularly up north. I think Ms. Perez presented some of what healthcare workers would have an active or cases actually. So what you do is shifting of health services within your facility. If in point of fact you start to have a facility that's overwhelmed, then you will have to consider whether you turn it into an actual COVID-19 unit and then channel your patients to the regional hospital, or you can do it vice versa, whether your regional hospital becomes your COVID-19 unit and you channel your patients to a community hospital. You work along with the numbers you have, as has been happening with, for example, Carlution has been gradually expanding their COVID-19 unit, where they initially had 6 ventilators to now they're having the ability to ventilate between 18 to 20 patients. So you expand as you move along with the resources. You fold back some services because you don't have that huge amount of human resources that you can carry forward with whatever you need to do. So you fold back on electives and things that you can, and you basically keep an A and E wing and a COVID-19 situation.